Now, I love to welcome Eric. As you've spent any time with New Patient Group or watching videos, then you know how amazing he is at the quality of effort that he puts in. And there he is. There's that face. And he has been in the healthcare realm for so long, and we're so lucky to have him on our team and really one of our leaders. So we are excited to welcome him today and presenting. And actually, this month is our Children's Dental Health Month, which I don't think he knew about, but it just so happened to work out. So that's something that on the social media front, we're celebrating that, and in tandem talking about these crooked teeth and oral health, the connection there. So take it away, Eric. Thanks so much, and we're looking forward to hearing more.
Yeah, absolutely. Thanks so much, Haley. I appreciate that. And this is a topic I'm really passionate about. It's something I see as almost a little bit of a hobby for me. I just really enjoy digging into more of the clinical side of dentistry and orthodontics. Something I'm very intrigued by. Maybe it's just a little bit of the scientific side of my mind that really appreciates and enjoys understanding to a reasonable depth. And I'm certainly not a doctor. I'm never going to be able to speak the language the way that our doctor clients are, or people that you get a chance to work with routinely as well. But it is something that I think that each of us, as somebody within this industry of orthodontics and within dentistry, that having some knowledge, some remedial knowledge, like Haley mentioned, is really valuable. And I hope this course and the discussion we have today is going to give you some of that. Right. And great comments on some of the other things that are going on in our world. Hope we'll be able to catch you when you come around in March for Brian's presentation on those phone call skills. And then Brian and I just had a wonderful, fun time recording that financial presentation university. So again, if you're already a subscriber, already a coaching client of ours, you'll have that available. If you're not, boy, check that out. That is such a great concept. It can really improve your revenue flow and your new case acceptance. So agenda for today, we're going to be working on a few key bullet points, right? Is appreciate the connection between that malocclusion and the oral health environments, being able to kind of tie that together from a cause and effect standpoint. To help us do that, we're going to be talking about a 3-point malocclusion assessment. All right. And with that assessment, that's going to be important that we understand just kind of some simple skills of seeing the scenario and being able to put the scenario into perspective of how it's contributing. And that's where it leads us into a really fun idea that I have a lot of fun with, and we call it dental CSI, right? It's that crime scene and understanding what's going on and what's leading to the unwanted events. And then ultimately, we're going to spend time in today's presentation practicing our new skills, right? So whether I'm a front desk receptionist, maybe I'm a treatment coordinator, an assistant, whatever my role is in the practice, I think it's good that we're able to practice some of these skills from the connection of malocclusion to oral health. Now, with that, I do want to ask for lots of participation, right? This is meant to be a very interactive presentation today. Right. And the best way to interact, I saw Haley mention it there. Offer your comments in the chat. All right. Type in your responses. I'm going to be asking for you to pull things out of some images. And so make sure that you're offering your feedback. And I'll call it, it's even kind of an expectation. I would like everybody to provide some feedback as we go through using some of those assessment skills. All right. And additionally, write some things down, take some notes today, because these are things that you can leave today's presentation, and Monday morning, as you get back into the practice, I hope you're applying some of these newfound skills. And so taking some notes with pen and paper is going to be very advisable. All right, now, this is not something that, I've, inherently had always within me. These are things that when I came into orthodontics and dentistry 12 years ago, I had no clue. I had business background, I had healthcare background, but the whole idea of dentistry and orthodontics was really foreign to me. Just like a lot of you maybe came into this environment with very basic understanding of orthodontics, right? But what I did is I raised my hand. Every client, every customer, every partner I had of an orthodontist or a dentist or team members within, I asked questions. I tried to engage in so many ways so that I could have, beyond even remedial, I wanted to have some more in-depth understanding of how and why things are happening, ultimately how to overcome those things that are happening. But also, for me, it was about how do I help to communicate to the patient? How do I help the people that I had the opportunity to work with? Maybe it was a treatment coordinator. Maybe it was an orthodontic assistant. Maybe it was the doctor themselves. How do I help them to be better at communicating the things that they're seeing? Right. And so I want to encourage you. You might be where I was 12 years ago. You may already be more advanced than I was 12 years ago. Is ask questions, engage with your doctors, engage with people that have been in this industry for many years, and ask questions that just you don't know, right? The only way you're going to know is by engaging in some conversation and letting them help to fill in the gaps. But that's where I hope to give you some foundation on this as well. So let's get started here. And I want to begin just making sure that we mutually are in a same mindset on a couple of really key principles. The first one here is, can we agree that the best dentistry for the patient is the least dentistry, right? And what I mean by that is helping them in a proactive manner. I mean that we're seeing things, we're seeing trends, we're seeing connections that would be unwanted. Right? Things are happening that we wouldn't want them to continue down this pathway, because we know that 5 years, 10 years, 20 years from now, things are coming that we wouldn't want them to incur. And so to give them the best dentistry, the idea is that we are prescribing and we're proactively educating them about how to avoid more dentistry. I hope that makes sense. And so that's a mindset that I hope we can share. And that's one of the key principles we'll talk about today. A second one here is, can we agree that teeth that fit together properly ultimately are going to need less dental work, right? When those teeth all align in harmony, they interdigit well in those back teeth, right? They fit together so nicely that that person is well set for a future of less dentistry, less dental work, less dental time, expense, pain, etc. And so that's something I hope that we are trying to seek out on their behalf, right? Is getting teeth that fit properly, ultimately to give them less dental work in the future. So I hope we can agree on that principle, okay? And then thirdly, can we agree that the patient's cost for treatment is either going to be now, or ultimately it's going to be later, right? And if you ask yourself honestly, if we take care of things now and we work in a proactive manner, I hope you'll appreciate that that's actually going to be a smaller investment than if that patient sits on it, waits a decade, 2 decades, whatever, and now they're investing in not only the problem that initially existed, but probably a handful of other problems that now exist because we didn't address it. And they might be a variety of different problems. And honestly, they're problems that people really despise about their dental relationship. Right. And so patient cost per treatment, we can minimize it if we proactively work today versus reactively addressing things down the road. So I hope we agree on that thought as well. Right. And I hope we also agree on this thought here, is that misaligned teeth, they will worsen over time. Right. So crowding that we have in the lower front teeth, which is so common in the majority of Americans, it doesn't stay that way, right? Whatever mild crowding we have as a teenager, by the time we're 25, 35, 50 years old, it has progressively gotten worse, right? Maybe it's the level of a deep bite has progressively gotten worse with time. Maybe it's some recession that we're dealing with from our malocclusion, has progressively gotten worse with time. And these indications, these pictures really depict this quite nicely of how, when the misalignment goes unattended, how other issues, and you can kind of see, I know these are cartoon images, but if you've been in this industry for a while, you can attest to these changes that are taking place over time. First opportunity here for some interaction. I'd love to hear somebody share their thought or idea of what is mesial drift, right? What are we talking about in dentistry and orthodontics when we describe mesial drift? Does anybody have a simple explanation for what mesial drift is? If you do, give it a quick type out in your chat there. Give it a moment here to see if Haley sees someone come up with a definition or an idea of mesial drift. I'm going to go ahead and kind of describe this. So this is something I want you to all be able to understand, that when you have crowding, and so with crowding, you can imagine you got this bit of overlap of some teeth. Maybe you've got some rotation of some teeth that adjacent to one another. But mesial drift is where the back teeth are applying a pressure, pushing forward. Okay, forward meaning mesial. Oh, I do see a comment pop up there, Haley. I don't want to take away their thunder. What are you seeing there, Haley?
Natural movement over time is forward into a position of greater crowding. That's Dr. Speck.
Of course. Thank you, Dr. Speck. Appreciate that. Yes, absolutely. So you're getting this push from the back teeth, kind of everything's pushing and applying pressure on the front teeth. And you can imagine, if those front teeth are really nicely aligned side by side like that, as mesial drift occurs with age, there's less likelihood of it getting worse, right? Especially if you're wearing a retainer routinely over that. But if we have that overlap or we have that rotation, and now that pressure pushes forward, you're going to see worsening of the overlap. You're going to have some teeth get pushed out, some teeth get pushed in, some teeth rotate more extremely, and the problems get worse in doing so. So absolutely, Dr. Speck, thank you for that. But I want everybody to appreciate what mesial drift is, because that's a term that's not hard to describe also to the patient sitting in your chair. All right, this is a great question, right? So raise your hand, and I'm not going to be able to see you guys doing this, but I'm sure we'll have some hands in the air. And especially if you've ever been in a dental practice, you get this a lot. Raise your hand if you've ever heard a patient say to you, hey, no offense, but I really don't like coming to see the dentist, right? I really don't like when I have a dental appointment scheduled, right? It looks like somebody's got their hand raised there on our Zoom meeting. But if you work in a dental practice, this is almost a daily occurrence to have someone say, I really don't like coming to the dentist, right? And what that really means to me is that really that they don't like seeing the dentist, that they don't like seeing their hygienist, or is it they don't like the possibilities of what could come from seeing the dentist? It may not be the routine cleaning that they're scared about. It may not be the routine visit from the dentist coming to talk to them that they're scared about. It's what's the message that might follow that. It's the message of, hey, we need to have you come in 2 weeks from now because you got a cracked tooth, or because you got cavities, or because this or that or the other thing. And those are the things that make people go, I really don't like going to the dentist because I don't want to come back for that next appointment that is potentially painful, it's potentially expensive, and it's certainly inconvenient to their busy schedules, right? So I want us to interact here. If you were thinking in a dental world, what are the top 3 or 4 procedures that you see a dentist doing more often than anything else? What do they spend a lot of their day, a lot of their time scheduling patients for certain procedures? Let's take a moment and have people throw in some chat comments on common dental procedures that the patients oftentimes find themselves being participant to. And if you're watching on a replay of this video, you should be doing the same right now as you watch on a recording. Haley, I see maybe we have an answer popping up.
Yep, fillings.
Definitely a lot of dental fillings being done in a practice. What else do we see commonly in a dental practice?
Definitely crowns.
Big time, absolutely. Broken teeth, therefore crowns. Okay, we'll see if we get 1 or 2 more answers here.
Adjustments on braces.
Okay, there we go. Good, good.
Very true.
Well, let's take a look at my list here. And I've done this a lot. I've had this conversation with dentists and hygienists and assistants and asked them, what do you guys spend a lot of time on? Haley, I see a couple more answers.
Oh, yeah. Getting numbed up and wearing. Probably wearing.
Yeah, wear patterns. So just wearing teeth, right? Yeah. So these are the procedures that I routinely run into. We mentioned fillings, and especially you get a lot of interproximal fillings. So between the teeth, contouring and reshaping, that would be from wear patterns that were mentioned. Veneers might be used to cover wear patterns that have happened over the years. If you're a hygienist, you're going to spend a lot of time on perio maintenance. Crown and bridge was mentioned. Implants and endo are common, but maybe not as common as some of those ones above. So here's the real question when I see this list, and I mean, these are the things that are so everyday in a dental practice, and they're also the reasons why people go, I don't like going to my dentist, is to ask the question, which of these items have a direct correlation to poorly aligned teeth? And I think you'll find that the answer is they almost all do. Right? The reason why we see so interproximal fillings is because you have crowding and overlap teeth that are tough to clean around. The reason why you see contouring and reshaping of teeth is because they're getting worn down by teeth that don't fit well together. Veneers, similarly. Perio maintenance. Now, that might be something completely off of misalignment, but you could also have perio maintenance because teeth that are getting pushed outside of the bone and you're seeing significant gum recession. Crown and bridge, back teeth breaking down, fracturing over time, etc. A lot of things that are spent in the dental office directly correlate back to misaligned teeth. And so again, if we're thinking in a proactive manner of reducing unwanted dentistry, I think you can see where I'm going. We need to look at alignment to provide a benefit to reduce all those unwanted procedures. It's a core foundation to give them a better setup for future dental success. Right now, most common effects of misaligned teeth, I just want us to have kind of a general perspective. So as an orthodontic assistant or a treatment coordinator or a front desk receptionist, whatever your role is, we don't necessarily have to go into all the weeds of things, but I do want us to have a general appreciation and hope you'll take some notes on common effects of misaligned teeth. Anterior wear patterns, anterior meaning front. So seeing front teeth wear down, chip, etc. Very, very common. So just speaking high level, we're going to see a lot of anterior wear. Okay, we're going to see a lot of posterior teeth breakdown. Okay, so what are wear facets? Well, the little bumps on your molars in the back, right? Those cusps wearing down. Okay, so we see some breakdown. Back teeth, especially first molars in the back, they're the most common teeth that crack or fracture and need a crown. Right? In a dental practice, they do a tremendous volume of first molar restorative care. Right? So posterior teeth breakdown, just a good general term. Abfraction, we're going to look at what that means in just a moment. Gum recession, very common with misaligned teeth. Okay, seeing the tissue moving its way down and exposing more of the tooth. Interproximal decay, we mentioned that. Interproximal meaning between the teeth, and cavities in between the teeth are very common with especially crowding. Right, and then also some airway issues, and there's more and more science and research out there about this today than ever before. So whether that be snoring, mouth breathing, sleep apnea, definitely comes from some airway issues as we have maybe some constricted arches, right, where the tongue maybe doesn't have a proper home to be settled, and it can cause some airway issues. So just, if you haven't taken, maybe take a screenshot of this right now, but these 5 things are high-level items that can be dialogued with a patient that help them appreciate why we take care of misaligned teeth. All right, you guys tell me, I mean, when you got 2 patients, young patients like these pictures represent, which one of these 2 is set up for a better oral health future? Right? They might both be 12, 14, 15 years old, whatever, but which one is going to have a better future 5, 10, 20 years from now based on what we're seeing in the picture? I think the answer is quite obvious, that person here on the left is really set up to have a great oral health environment for many years to come if she just has some routine basic care. Right, so with that, let's talk about some skills that I want our team to be able to appreciate. First thing we're going to talk about is a 3-point malocclusion assessment. So these are going to be 3 simple pearls that we're going to be able to look in the mouth and instantly pull some information to help us put the story together. Right, and so the first point of our malocclusion assessment is we're going to be evaluating what's the arch form look like. Okay, and we're going to be talking about, do we recognize any teeth that have a tooth inclination concern? Inclination meaning leaning. Okay, and the third one is a really big principle, and the doctor that you work with is going to be really capable of educating you more in depth about canine guidance, or oftentimes called canine function. But I want us each to have a little bit of an understanding today of what that means and how it connects to the oral health environment. But let's begin with arch form, okay? And here's 5 pretty common arch forms that you're going to see just as you evaluate pictures, as you're in the mouth, whatever your circumstance is. And again, just general knowledge, your broad U-shaped arch going to look a lot like that. And this is kind of what we want arches to look like, right? Even though you see a little crowding in the front on this example, this patient's got a great foundation of a nice broad U-shaped arch, right? Then you've got a narrow U-shaped arch, right? So you can see how the back teeth are just a little bit tighter together. The palate's not quite as wide, right? And with narrowness, you're going to have a bit more likeliness for crowding in the front teeth. You might have a little bit of protrusion of the front teeth where they stick further out towards the lip, right? So you can clearly see, boy, if we could take that narrow arch and give it a little bit more broadness, you're going to solve a lot of problems. Pretty easy to see. Easy to educate the patient when you see that as well. Then you've got a V-shaped arch where it comes a little bit more to a point, right? You're going to have more coexistence of crowding again, right? You can see how these front teeth kind of flare out a little bit towards the lip, right? So a V-shaped arch, which also is similar. You've got a box-shaped arch. Look at that very squared off box here. And with a box-shaped arch, you're oftentimes going to see the canines, these 2 guys right here, where they're rolled out. You see how they're kind of rolled out? And then the front teeth are leaning back, right? That's what gives it that very defined box shape. And those leaning back teeth are probably right below some top teeth that, guess what, are also leaning back. They're forcing those front teeth in towards the tongue, and it gives it this distinct box shape pattern, right? And then omega meaning the Greek symbol omega, like that, right? Circle kind of pops out. And that's what we see here is we got kind of this rounded front. We got kind of a narrowness here, and then it kind of pops back out as we get to the back teeth. So that's an omega shaped arch. Actually, it's more common than you might think. So you got 5 types of arch forms that are just kind of good to be able to recognize when you're looking in the patient's mouth, because they do help to tell the story. Okay, and then you've got the tooth inclination is our second point of the 3-point assessment, right? So tooth inclination is this. Well, which teeth do we see in this picture that are leaning either towards the buccal, towards the lip, or leaning towards the lingual, towards the tongue, right? So as you look at this, and maybe you can kind of throw up some comments here into our chat, give you a moment to analyze what you see. What teeth do you see in here that lean inward towards the tongue, or what teeth do you see in here that maybe lean a little bit more towards the lip? We'll give this a moment for you guys to capture a few notes. All right, as you're getting your notes taken, maybe throw some up here in the chat. What are you seeing? Let's start with the lingual. Do we see some teeth that are leaning towards the tongue more than we would like?
33 and 43.
Okay, so we're talking dental lingual there. All right, I'm not so great with the dental numbering system, but I'm guessing we're in this vicinity right here. Okay, over here.
They said yes. Someone said the left one. I think I missed that a little bit earlier though.
Okay, we got over here as well. Yeah. So as I look at the lingual, okay, we'll look at that in a second. There also is one tooth buccal. So towards the lip that I have noticed. So what I have here is, there you go. The blue arrows for me give me a pretty good idea. I've got a couple of molars back here that are probably leaning in towards the tongue. You can see how they're constricting the arch. That tongue's going to be struggling to find a home in between there. You've got these 2 guys here, your canines, that are leaning in towards the tongue. And then you got this green arrow here on one of the incisors that is just a little bit further out towards the lip than the rest of them, right? So definitely we can take some note on some tooth inclination teeth that's going to help us to tell our story. But the thing that you would do with this then is say, okay, well, how are these teeth being out of position impacting the health of the mouth, the health of the teeth themselves? We're going to get to that in just a moment. All right, and then we're going to use that knowledge, how we recognize the cause and effect, and it's going to allow us to better tell the story to the patient. All right, that takes us then to our third step of the malocclusion assessment, and that is canine guidance. All right, got a little image here that's going to help us to appreciate what canines do. All right, open and close. You can see those canines are big teeth, big sharp edge on it. All right, and so canine guidance, all right, we're going to talk about this. I'm going to actually have us do a little demonstration, right? But just a quick point here, when you don't have canine function, you are working out of group function. So if you're taking notes here, canine function good, group function not as good. All right, we're going to talk about what that means here. So let's actually do a demonstration of this, excuse me. All right, so you can see me here. I'm actually going to take my screen share off for just a moment because I want you to see me up nice and close. Here I am. I'm going to embarrass myself for a minute, but I want everybody to participate with me. And trust me, we can't see you, so don't be embarrassed. Right, but canine guidance. Let's do a little demonstration of this together. I want everybody to bite together on your back teeth. Okay, biting together nicely on your back teeth. All right, then as you are working to shift your jaw left and right, I want you to see what happens with your bite. So we're biting and we're shifting. Okay, so hopefully you're recognizing that as I work to shift my jaw left and right, while I'm still trying to bite on my back teeth, my canines, those two big teeth on top and bottom, are forcing my bite to separate. They're forcing my bite to open. And I can't move my teeth left or right without the bite first opening up. Right, so you can imagine that as we go through our day, as we eat our meals, as we whatever with our mouth, the benefit of the canines forcing my bite to open protects my back teeth from wearing on each other, hitting in ways that we wouldn't want them to be hitting. Right now, as you are doing your little at-home demonstration, perhaps some of you were able to shift left and right and your bite didn't open. Your canines didn't cause separation to occur. That would mean that you lack canine guidance. You lack function, and you're actually now functioning out of that group function that I was describing, right? And group function means, group meaning many. Group function means that your back teeth, your molars and your premolars that have all those bumps everywhere, all those little bumps are working like little miniature canines, right? They're guiding off of each other. And so, but what can happen is, in the back teeth, you got hills and valleys like this, right? Your teeth want to come together in hills and valleys. That's good. But when you lack canine guidance, sometimes the hills come together and then they slip and find the valley, right? And then the hills will come together and they'll slip and find the valley. And that repeats over and over and over all day, every day. And your canines aren't doing what they're supposed to be doing. And what do you suppose happens when we lack canine guidance is your back teeth can begin to break down, wear down prematurely, and lead to many of those unwanted dental events. Wear facets, fractured teeth, worn off teeth, abfractions, recession, back teeth type of issues. We're going to look at that in more detail, but I just want you to appreciate how important canine guidance or canine function is. If you want more dialogue about that, go to your doctor, talk to them. They're going to understand it 100 times better than I do. Let's look at an example of this. If we're looking at this example, we saw this photo a moment ago on our tooth inclination, and we just ask ourselves, how would we rate this this patient's canine function? So first, we've got the right side over here, the patient's right side. And if you look, you can see there's a gap. You see that separation between the lower canine and the upper canine. And it's not hard to appreciate that the gap they're not guiding is because, we'll look down here. This was one of the teeth that we saw a moment ago that had a tooth inclination concern. That tooth leans towards the tongue, and therefore it's not guiding against the tooth that's on the top, where if we could push that guy back out into the arch where he should be, you're going to have guidance appropriately with the top tooth. Okay, looking over on the other side. Now, similarly, we had this tooth inclination concern here, but we also have a bit of a tooth inclination challenge here. See how sharply angled that tooth is right there? Well, so you might still be getting some canine guidance because they're both leaning, right? But it's still not optimal. Upright that tooth, push that tooth out, and you've got a better foundation from a guidance that's going to protect those back teeth, all right? So we see these things that I'm describing, right? And then you ask yourself, what evidence do we see that's being left over because of years and years and years of poor canine guidance? And this is going to lead us into our next topic, but just look at, you know, the back teeth that have broken down over the years. You can just see all the dental trauma that she's been through. And this is part of her story. These are helping to tell the story of these things that have occurred over the years of not addressing the alignment scenario. And this leads us then into that thing that I love. That's that dental CSI. It's the crime scene. You guys, if you're a fan of the CSI programs, you probably recognize our friend here, right? But the idea is that that's what you're dealing with here is all the evidence of issues, you know, the one we saw with the broken teeth and recession or abfractions and all these unwanted events are like this guy laying over here. It's that dead body. Pardon the pun there, the analogy. And we've got to go back in time and help to tell the story, help to put the crime scene together. All right. And so we're going to be using our understanding. We're going to take our arch form. We can take the inclination of the teeth. We can take what we now know about canine guidance, plus just general understanding that there's crowding, general understanding that there's a deep bite, general understanding that there's a cross bite in the back teeth. Just typical malocclusion understanding is going to also help us to put together the cause and the effect, right? So the causes lead to the unwanted effects, right? And we can go terribly in depth with this. You could go in depth if you're really intrigued by this concept with your doctor. I just want us to understand it again, more high level, right? So we're going to put this into some practice here. Let's take a look at our example we were noting a moment ago. And I want you to jot down piece of paper right now. What do you see in this image that is not optimal from Carolyn's dental health standpoint? All right, what do you see in this anterior picture that is like, that's not exactly what I would want that to be like at her age? It's unwanted. Take a moment, write down, 3, 4 different things that you might be seeing in this picture.
Nothing yet.
It's all right. We'll just, if they want to just write them down on this one's fine. And then I'm going to compare my notes, see if we compare favorably. Okay, let's take a look here. So the first thing that I saw are abfractions, right? We're going to talk a little bit more in just a moment about what abfractions are and how they occur. But these abfractions are where we see these kind of brown places right up at the gum line. This is a really significant one here, right? But these little abfractions, you'll see them pretty commonly, especially in your middle-aged to older adults, where you've got like some notching. It's like a little notch at the side of the tooth, right up at the gum line. Can be a place that's really sensitive to patients as well. So we definitely can see we've got abfractions, right? Incisal wear, all right? So we can see here, you got some just uneven wear patterns on some of the front teeth. And boy, I'll tell you, if we opened up her bite and we could see the lower front teeth, that's where you see a lot of wear patterns. All right, we already mentioned we've got the canine guidance and some tooth inclination items that were mentioned earlier. We definitely can see that Carolyn's got a deep bite, right? So her top teeth are overlapping her bottom teeth more than we would want it to, and that's contributing towards some of the unwanted events. All right, now let's look at this also from the occlusal perspectives. So what do you see in here that would be unwanted, that's accumulated over time from, just whatever our issues are? All right, for the sake of time here, we've already mentioned we've got some back teeth that have significantly broken down over time. She's got some really old dentistry. Looks like it's been in here for a while. Got a newer crown over here. But her back teeth have really been through some some time. And trust me, she's probably spent a lot of money, a lot of frustration. But the reality also is even after fixing something like this, if the bite still isn't right, she's likely to see these break down and need repair again. And she's not going to be happy with that, right? So posterior breakdown. Incisal wear patterns, we can kind of see the blunt edge, and you can almost see like this line across the front teeth here where we've seen some incisal wear. The enamel's been worn through, and now we're getting down more into the dentin there. Right now, we maybe can't see this in these pictures, but if Carolyn went in to see her dental hygienist or a dentist, likely going to have some areas where plaque and calculus are building up in the crowded areas. This would be very common, patients with crowding, that you're going to have some excess plaque and calculus building up. All right, so there we got some other issues that have mounted up in Carolyn's dental current as well as dental past. All right, so let's work at putting our crime scene together. We're going to think in reverse. We just described the aftermath of what's happened. But if I look at this and say, okay, calculus, buildup, other perio challenges, that's an effect. What do we see from Carolyn's images that would help to contribute the story towards the unwanted plaque, calculus buildup, as well as other perio challenges? Okay, so this is where we go back to our 3-point malocclusion assessment. And what I have written down here is, well, we got some crowding, right? Crowding is going to be very common in these issues. We got some narrow arches. We talked about that earlier. And we already used her example to demonstrate some tooth inclination, right? So the fact that we've got inclined teeth in and out, narrow arches in the back, crowding, they all are contributing towards these unwanted things that she's experiencing. How about the incisal wear pattern? So we got the little uneven wear on the front incisor here. We got a pretty consistent uneven wear on the lower incisors here. What are we attributing that towards? Well, we mentioned she's got a deep overbite. Her upper teeth are overlapping further than they should, contributing to wear patterns on front teeth, very common. And also retroclined front teeth. Look at these upper front teeth right here. Tooth inclination, those would be two teeth that are inclined the wrong way. They're leaning back towards her palate, and you can understand that these two teeth are causing wear on these bottom teeth, and especially when you put that together with her deep bite, no wonder she's getting wear patterns. And it's going to continue to get worse until we take care of why it's happening. How about those abfractions, all right? The indentation and that excess, kind of where the recession's taking place there. We're going to talk more in depth about this again in just a moment, but that's going to be attributable back to our canine guidance. She lacks canine guidance, especially over here on this right-hand side. And she's got some tooth inclination problems that we talked about. These molars back here are leaning in heavily, right? So we would be able to say those abfractions are likely because of some issues with her bite. Then we mentioned all that posterior breakdown, right? And we can take that right back to the canine guidance. She's not protecting her back teeth. They're not coming together as ideally as they could back there. And we're getting all that breakdown over time and will continue in the future. So this is that cause and effect story that we're looking for, that we just, again, I just want us to have some general understanding of how and why it becomes to look the way that it looks here. Right, so let's talk about those back teeth for a moment, right? Lateral force and stress, right, can lead to, we can get the cusps are breaking down, right? So look at the inclination of this top tooth hitting against this bottom tooth. You can see how it's going to wear that spot down, okay? Likewise, imagine the stress that this bottom tooth is feeling. It's not hitting straight up and down. It's hitting at an angle. It's kind of like taking a fence post and putting it in the ground at the wrong angle and still pounding it straight down. It's going to do this, right? Well, that's kind of what that tooth is feeling, is stress right where it is connected. And so that abfraction over time starts to notch away, right? And a dentist is going to spend a lot of time filling that in. They're going to do a filling in that. And guess what's going to happen in a short while after that? It's going to be right back, right? Give it months, give it years, but that abfraction, if we don't solve this problem, is going to come right back and the patient's going to be frustrated. Okay. And over time, if we really allow this to continue, you're going to have some tooth mobility where the tooth starts to lose support from the bone. The recession, that gum's going to move all the way down as we lose bone. And now you're really at risk later in life, those teeth not staying in the mouth. Okay. So that's really a big one. That's why, the canine guidance being so important to help protect the back teeth. All right, let's do it again. We're going to go pretty quickly through this one here. And this is a great example, a younger patient that I want you to appreciate, that we're at earlier stages of those cause and effect problems, right? But we can still look at this J example, right? And you can take a few notes here. What are things that you're seeing that would be less than optimal, even as, 20-year-old Jay comes in to see his orthodontist? He's looking at the idea of doing orthodontics, Invisalign, clear aligners, whatever. But we can build this story more powerfully for Jay by making him aware of things that go beyond the way things look. Jay's probably looking at this going, well, I really don't like the way these teeth over here look. But the reality is we can see things beyond that little indented tooth that are more concerning now. And as we project forward into Jay's future dental health. So a couple things I'm seeing here. Look at that little wear pattern starting to develop right there. Okay, look at that bit of recession that's just starting to detach on some of these back teeth here. Might even be starting into an abfraction right in that spot. Got some recession over here on some of these teeth as well. You got that overbite, deep overbite here. Look at our canine guidance. Holy moly, Jay, poor Jay has no canine guidance here, right? That tooth is being completely trapped. You can see the canine here, completely trapped back by the tooth above it. That's that one that was twisted and turned inward. All right, so Jay does not stand a chance for canine guidance because of this area. So it's not just the way it looks, it's how it's impacting the function of his bite. And he's already starting to see the detrimental effects of poor canine guidance back here. And now he doesn't have the previous example where they're all broken down, but give it time. Okay, it's coming. Meanwhile, we got the wear pattern here. Well, let's look at this. If we look at Jay's lower teeth, you got this little tooth here that sticks out forward of this one. And so it's no coincidence that the wear pattern we see here is right above the tooth that's sticking further out. All right, so if we could get our arches better formed, we could fix the deep bite that we have here. We're giving Jay a better chance to not see this wear get worse with time, right? Jay's got healthy teeth generally right now. Let's give him the chance to make that stay that way through great education, great understanding of the things that are going on. And again, if we can just speak a little bit high level to him about some of these cause and effect patterns, common issues of malocclusion and misalignment, it's going to make his motivation stronger to begin treatment than purely the motivation of looking nicer. And that ties back to that course that Haley was mentioning a bit ago, is flipping the narrative, right? Is turning the narrative from cosmetic into the narrative of function and health. When you put those stories together, you're doubling their motivation to move forward with treatment. It's a very powerful skill set. Right? And you can use your digital imagery in the same way. Use that scan that you just captured, pull up that raw image. We get this great raw image like this, and we can tell the story the same way. Now, I can't rotate mine here. It's just a static image. But if I pulled this thing around and I started talking about how teeth should fit together, I started talking about the importance of some canine guidance to protect back teeth. I could start talking about some initial wear patterns that might be notable down here on these front teeth. If I can just give a quick 1 to 2 minute account of what's going on, it increases that motivation and urgency to get started with their treatment. Right? We can educate so effectively from these 3D digital images, and you can even then take it to the degree of use your technology with the occlusogram. I don't know if you're using this or not in the hands of a treatment coordinator, definitely in the hands of the doctor. I mean, what a cool image to help relay the story of what's going on and how teeth are hitting and why certain teeth may already be banging down and wearing down, and what the future is going to look like if we don't begin to address this as quickly as possible. Okay, so I hope we are using our digital technology to our advantage, not just from a treatment planning standpoint, but a patient education standpoint as well. And I'm not going to spend a lot of time on these, but I want you to appreciate this is an easy conversation, right? So Jenny comes in and Jenny's got a lot of motivation to get things fixed. She's spent years of not enjoying what she sees in the mirror here, or what she sees when she takes a selfie image, right? And we can build the story very effectively from, look at all the tooth inclination concerns, right? Look at the canine guidance challenges that we're dealing with. Look at the level of the deep bite and the crowding that helps them. You look at the omega right here. You guys see the omega arch on this side, right? Just the story sets itself so easily, but she doesn't need a ton of motivation as compared to Ashley here, right? Ashley was our example of that nice broad U-shaped arch. The upper arch is similar. And so Ashley comes in and she probably has some frustration cosmetically of how things look, right? But when we start talking about $6,000, $7,000 of a treatment fee, Ashley may lose her motivation, right? But if we invested time in explaining to her why this is happening, why the wear patterns here are developing, right? Why other things might be occurring, but yet they're at very early stages, we can educate her that it is important to take care of this. And this is a perfect example of mesial drift, right? Ashley at 24 years old, that overlap, that crowding isn't going to look like that in 10 more years, right? It's going to be worse. It's going to be harder to treat. And the problems that they're already causing are going to be more significant. So we take a proactive approach and we double her motivation to begin treatment. And then you can back up the clock, even, Jacob here, 12 years old, maybe 10 years old, not sure exactly, but the story is easy to tell here as well. But yet Jacob has healthy teeth. He's early in life. His teeth are still in wonderful condition, but they're not going to stay that way in 10 years, 20 years, right? And we can tell this story very easily, but the narrative changes a little bit when the physical evidence of damage doesn't yet exist, right? We have to be able to talk in more of a consequence verbiage of, if we do nothing, here's the concerns I feel we're going to be dealing with in the future, right? And when you do that, you do come off as quite unique because you're educating them in a way that's different than what most practices are doing, right? Now, that's a whole different dialogue, right? The actual communication piece of this is, again, a big part of that exam room innovation course that Haley was referencing. It's a big part of the flipping the narrative course. It's just talking the talk once we have an understanding of what we're seeing in the images or the scan or the actual patient, the patient's mouth. All right, so again, I hope you'll invest some time into that. If you don't have that course, again, reach out to myself or Haley. We'd love to talk to you more about those course opportunities. All right, so like I mentioned, as a reminder, right, these are the two courses in your NPG University, where we've got the Clear Aligner Growth Exam Room Innovation course, where you're going to find these concepts in more depth, right? And then the Flipping the Narrative, Doubling Your Patient's Motivation, similar dialogue to what we trained on today, but then also moving that dialogue into presentation skills. Right, so whether that be a treatment coordinator, might be an assistant who's just kind of chatting with the patient chair side, definitely the doctor presents on these things quite routinely, going to pick up some pearls there as well. All right, so with that, I do want to open this up, make sure there are any questions or any comments that you have off the things that we've worked to install today. You've got your 3-point malocclusion assessment, right? Remember, that's arch form, it's tooth inclination, and it's canine guidance. Okay, we want to be able to do a quick assessment. And then we talked about the dental CSI, the cause leading to the effect. And the effect are all those things that patients don't enjoy about their dental process, their dental routine, right? We want to help them avoid those effects by going back to the cause and addressing those issues.